Hi, everyone. Welcome back to another episode of CHD Unpacked, a podcast about living with congenital heart disease. This podcast is brought to you by the Canadian Congenital Heart Alliance. I'm your host, Amanda, and today we'll be unpacking the topic of CHD, education, and employment. We're very excited to be joined by today's guest, Dr. Adrienne Kovacs. Dr. Adrienne Kovacs, a clinical and health psychologist, spent 17 years fully integrated within cardiology divisions, first at the University Health Network in Toronto, and later at the Oregon Health and Science University, where she was promoted to professor in 2020. She is the past president of the International Society for Adult Congenital Heart Disease and the first non-physician to lead this organization. Dr. Kovacs is a fierce advocate for the psychological care of individuals living with congenital heart disease. She has given over 150 invited presentations at national and international meetings in a dozen countries and has over 130 peer-reviewed publications. She also chaired the 2022 American Heart Association Scientific Statement on Psychological Outcomes and Interventions for Individuals with Congenital Heart Disease. In late 2021, Dr. Kovacs returned to her hometown of Toronto, Canada, where she launched Equilibria Psychological Health. She is now dually focused on the psychological well-being of adults with heart disease, as well as healthcare professionals, and maintains academic commitments in mentorship and research with long-standing collaborators. Please join me in welcoming Dr. Adrienne Kovacs. Hi, Dr. Kovacs. Welcome to CHD Unpacked. Thank you so much for joining us today.
Thank you very much for the opportunity to be with you again today.
So today we're going to be talking about CHD, education, and employment. To kick off the episode, would you be able to tell us a little bit about the scope of your practice?
Sure. Thank you. Thank you again for the invitation. So I'm a clinical and health psychologist, and I have been a psychologist for almost 20 years. And for the past 20 years, I've actually spent a lot of my clinical work working with adults with congenital heart disease. So I began during my training in Florida, and I was in Toronto and then in Oregon for several years, working embedded within congenital heart disease teams. And so I did a lot of clinical work there. And I also did research, so research looking at psychological outcomes and also that transition from pediatric to adult care. And that's where topics like education and employment ideally are introduced. And I'm so glad that you've chosen this topic for today, because I think that over the past few decades, when we think about outcomes in congenital heart disease, we no longer limit ourselves to thinking about medical outcomes. And we're thinking about things like quality of life, school, jobs, and really with the goal of people living as rich and full lives as possible. And so that's something I'm focused on in my clinical work. And I'm now in private practice as a psychologist, but I still work with a lot of adults with congenital heart disease.
Thank you so much for sharing that with us. And I agree, it's such a valuable topic to have out there and to share with the CHD community. So we're very excited to hear your expertise on this topic.
Great, my pleasure.
So to start off, talking about education, can you describe the types of challenges that those with CHD might encounter in their early years of education, such as in elementary school and high school?
Yeah. So I will say that challenges and outcomes are very variable. There's a range of experiences. So some people may have quite significant challenges with education, and some people may be minimally impacted or not at all. So there are a lot of factors that can potentially impact schooling in the early years. So we know that people with congenital heart disease as a group have increased risk of having neurodevelopmental difficulties, and that can make learning and attention in class difficult. We know that kids can sometimes have increased school absences. So that might be because they're having hospitalizations. Maybe it's just going to their annual or biannual medical visits. And for some people, there can be a long distance to travel. So that may take up an entire day or two Sometimes if people have physical symptoms and they're not feeling very well, they may have school absences. And so not being in school regularly can make it difficult to learn some of the information, but also to have typical peer interactions and to develop friendships. We also know that young people with congenital heart disease have a slightly higher risk of some psychological difficulties like depression or anxiety. And these also can impact schooling outcomes and can present extra challenges in and of themselves. So there's a lot of potential challenges that can occur, but again, it's so variable. So some people do really well in school. So I can't give a blanket answer saying this is how any one person will do. There's certainly a range of experiences, but as a group, there tends to be lower educational attainment because of some of these challenges.
And do you tend to see that these psychological symptoms, such as anxiety or a depressive mood, manifest in even children? Or does that typically tend to occur in teenage years and into adulthood?
Yeah. And I should mention, I'm an adult psychologist. So although I don't work with children, I do know all of us psychologists in the field are familiar with the whole age scope as well. It manifests or it shows up a little bit differently in kids. So sometimes with children, it may be demonstrated by behavioral difficulties. So with kids, we sometimes see both internalizing and externalizing difficulties. And so the externalizing might be behavioral difficulties or difficulty controlling the reactions and having appropriate behavior in classrooms. And there can also be internalizing difficulties, so things like depression and anxiety. And we tend to find that some of the rates of some of these psychological challenges are higher in subgroups of people with more complex forms of congenital heart disease.
You touched a little bit on neurodevelopmental conditions. We know that those with CHD might have other variable health conditions, such as neurodevelopmental conditions. Can you speak a little bit more to how that can play a role in their educational experience?
So we know that these neurodevelopmental deficits and disabilities tend to move in or to vary in correspondence with diagnostic or disease severity. So some forms of congenital heart disease are what we consider simpler and some are more complex or more severe. And it's the young people with more severe forms that are more likely to have some of these neurodevelopmental challenges, and they can really get in the way of learning. And some of these challenges are those that make it difficult to do well in school. So things like language skills or memory or concentration skills or executive functioning. So things like organizing and planning. And some of these challenges become more problematic as people move to high school or as they move to college or university because we expect them to take more responsibility. So in primary school or elementary school, it's really clear this is where you need to be at this time. There's not a lot of choice. As you get to high school, there's less supervision. And then as you move beyond that, there's even less supervision. So it can be challenging for some people to navigate having these difficulties. We know that, again, as a group, people with congenital heart disease have higher rates of attention deficit hyperactivity disorder or ADHD, as well as autism spectrum disorder. And again, those can make learning or classroom experiences more challenging as well. And I say all of this because I'll repeat myself several times and I'll say there's quite a range of experiences because we know that I think it's like 1 in 10 individuals in one study of adults had really high levels of educational attainment. So they went beyond university and they went to graduate school or they went to professional school like medical school. So again, there's such a range of experiences. And and now I'm saying we as a field of those of us working in congenital heart disease know that we ought to be doing a better job preparing patients and families affected by neurodevelopmental difficulties to start thinking early about what are ideal and what a good educational and professional planning experience. So how can we help people choose the kind of schooling and jobs that are best for them.
Yeah, and I think support along the way likely plays a big role in someone's outcomes, whether or not they have a neurodevelopmental condition that they're trying to navigate. So
Uh,
realizing that early on in someone's education might be helpful to kind of find the support that they need.
Absolutely. And I think ideally that begins in adolescence. And I realize a lot of people watching or listening may be older than adolescents, but maybe we have some parents joining us. But the earlier we can begin, the better, the more impact we have. And I remember reading one study, I think that fewer than 1 in 5 adults with congenital heart disease had ever discussed employment considerations with their medical team. And so we can say for individuals, ask your medical team. And at the same time, we want medical teams, so physicians, nurses, to start discussing this with individuals with congenital heart disease at a younger age so that they have an opportunity to help choose the educational and employment pathway that's right for them.
And involving your healthcare team in those discussions maybe doesn't seem like a natural instinct to do, but because it's such a holistic approach to care that we aim for in the CHD community, I think that that's really important to strive for to include your healthcare team in those conversations.
Oh, absolutely, because I think that your healthcare team can give you information about longer term health expectations that can help you make decisions. And for me, it's all about informed consent. And so we don't want people to unnecessarily limit themselves in their career, their educational or career aspirations. So if there's something that you really want to do, ask your medical team if that seems kind of reasonable.
Mhm.
The things that we get maybe more concerned or we want to be aware of are sometimes people have types of congenital heart disease where we think that down the road they may experience increased symptoms, and whether those are related to heart rhythm difficulties or heart function or heart failure concerns. It might mean that choosing a job that is very physically demanding or involves a lot of manual labor might be difficult down the road. So sometimes, and by the way, I get that it's difficult. If you're 20 or 25, you may not necessarily be thinking, can I do this job when I'm 40? However, that can be really interesting and really an interesting conversation and helpful information for your medical team to provide.
And just because the medical care is so variable, you never really know if you're someone that's prone to getting symptoms in the future when that might occur.
Oh, absolutely. And I will say that. It's a great question, a great comment, Amanda, because I've worked with people who have held back from pursuing jobs because they thought that they wouldn't be able to do it down the road. And it turns out they actually would have been. And then I've worked with people who have pursued very physically demanding jobs to be disappointed that they were unable to do them longer term. So
Mhm.
to me, it comes down to avoiding making assumptions and gathering as much helpful information as we can to make the decision that's best for any one individual.
Such an important point. Thank you for that. Along a similar line, for someone that's a young adult and they're potentially having conversations with their peers in school, and they're trying to navigate situations where they might not be able to keep up with their peers in certain activities that they might be participating in. Do you have any advice for how to navigate that conversation, both with respect to preserving their privacy, or feeling like they can disclose some aspects of their health information to their peers?
Amanda, I think that's a great question because I often hear individuals ask me about when and how to disclose to their peers. And that might be friendships or it might even be potential romantic partners. And again, I think it's very individualized. And so some people will be very comfortable talking about their health condition and symptoms, and other people will be much less comfortable. And so I think it's important that people work within their comfort zone and don't feel ever pressure to disclose information they don't wish to disclose. As I often say, you can choose to tell somebody something later, but you can't choose to untell something you've already disclosed. I think that if and when we do choose to provide information about our health, we can do so in a way that is matter of fact without apologizing. So without saying, I'm sorry I can't keep up with the group because this isn't something that actually people ought to apologize for. It's very matter of fact. So, we don't want to apologize unless we've done something that we regret doing. So acknowledging it in a natural matter of fact way without alarming people, without amplifying the significance. I do think it's actually really important to try and find people with similar interests as well. And so um, finding friends and a peer group who are actually interested in activities that an individual enjoys doing and is capable of doing as well. And so I think it's choosing wisely there. Um, and I think that one of the things, sometimes we talk about is balancing because there are some times when somebody will say, my health is irrelevant, I'm feeling good. And then there are maybe some times where they do wish a few accommodations or they may not have the energy to do things. So it's actually sometimes letting friends know that sometimes I'll be able to do things, sometimes I won't be able to. Please continue asking me. So I think making it really clear that they would like to still be invited and that they themselves have the option as an individual to decide whether they wish to accept or decline. And sometimes thinking about getting to university, it might be, if my friends are going to go to a couple different places or bars, let's say, it might be deciding I'm ready to go to one and then I'm not great at moving on to the next one or staying out. But I think anything we can do to empower the person to make a decision for themselves about what they want to do and to not be artificially limited. And I will say just before I forget, something else relevant is that when people choose to go to if people choose to go to college or university, I think it's really important not only to consider the academic program they want to do, but the campus itself. And there are some campuses that are really large and spread out where there may be a lot of walking between buildings on campus, or if they want to go out and socialize, there's a lot to do. And then there's some campuses that are smaller and a little more enclosed, and those can actually make it easier to do things with friends. So we don't usually talk about that, but I think the campus itself is actually really important.
Thank you for highlighting that. I think that's something that doesn't really get talked about that much. And, when it becomes part of your everyday life that you have to start navigating these things
Yeah.
and you start to think about it and it becomes a little bit more relevant, but can
Oh,
definitely play a role in someone's daily life and how easy it is for them and the struggles that they might have to
yeah.
plan out in their head every day.
Absolutely. I went to University of Toronto and there were campuses and we maybe had 10 minutes to get from one class to another. And I would be almost running and I'd get there late to another building.
Yeah.
Um, Somebody who has some stamina challenges, for example, it'd be difficult to get there and they may be less inclined to go out to do something with friends at night if just getting to classes has been quite an ordeal.
Right. And thank you for highlighting the aspects of disclosing to friends and peers because if you maybe have a plan in the back of your mind of how you might approach a conversation like that, it can be a little bit less daunting to have that conversation instead of feeling like you're pressured to give a response or to come up with something if you really don't want to disclose anything about
Yeah,
yourself.
yeah. I think nobody should ever be pressured to disclose. And then the other thing I will say, sometimes there might be an extra opportunity to propose activities that you can do. So sometimes there's the opportunity to be proactive, and it may be that, going for a hike may not be reasonable, but maybe going to see a movie is reasonable. So it's suggesting options that the individual would like to do and can do as well.
And if you're someone with CHD and you have people around you that you trust, you might want to
Mhm.
consider having a conversation about that. And if it's someone that you think is understanding of your situation, then it could just make things a lot easier in terms of.
Absolutely. Yeah,
Mhm,
agreed totally.
mhm. And for someone that has decided to go away for college or university, or is just feeling like they're taking more independence with their life as a young adult, can you explain why it's important to learn how to navigate the healthcare system independently when you kind of get to this stage of your life?
That's a great question, Amanda. I think that oftentimes appropriately so, parents are provide most of the healthcare navigation in childhood and adolescence, and it can be a real transition, particularly if somebody goes away to college or to university. And here's an opportunity for them to take increased ownership, independence, responsibility for their health care. And this is why we want people to know what their diagnosis is. We want people to know what medications they're taking, if they have any restrictions. And I often think it's not necessarily that something cardiac will arise when they are away, but it might be something like they're going for a walk or they're dancing or they're skiing or something and they break an ankle. And if they have to go to seek emergency services, it's good just to be able to let them know what's going on. And this period of transition, we used to think that people became adults when they were 18 or 19, and we just know that's not the case anymore. So we know that brain development, maturation continues to mid 20s to late 20s, and that really awareness of that has just emerged in the past decade or two. And so accepting that it is a process. And what that means is we want people to develop knowledge about their congenital heart disease. We want them to develop self-management skills so that they gradually become more confident making their own doctor's appointment, so that they become more confident talking to their doctors and nurses on their own at medical visits.
Mhm.
And at the same time, we ought not expect that people are perfect at doing it independently. So if you're a young person heading off to college or university, you can still ask a parent for help or advice. It doesn't mean you have to do it all on your own. It's just an opportunity to start doing some of these things on your own, like, you know, it might be the first time you've lived on your own and you're having to set your own alarm during the day, or maybe you're doing laundry and meal planning for the first time. This is something else that comes along with that. So we want to normalize it and say these are appropriate changes. There's just some extra little medical information and self-management skills that are important to learn along the way.
Mhm. And navigating the healthcare system is difficult even as an adult. Even once you've been
Yes.
established in a career, it can be increasingly difficult depending on the city that you live in and the services you have available. So just making that process something that's transitional rather than, just one day you have to do it all on your own and you go from
Uh,
taking the training wheels off and then you
yeah.
have to navigate it. So
Yeah,
just
yeah. And it might be something like reminding yourself if you need to schedule medical appointments ahead of time, schedule them when you're going back home in the summer or if you're going back home for a holiday. So whether it's if you have a family doctor, scheduling those appointments or cardiology clinic appointments, so you're not waiting till the week before, but scheduling in advance to coordinate with your schedule, I think is an important consideration also.
sure, I agree. And can you highlight any potential benefits that someone might have as a young adult with CHD in this transitional period of time in their life?
I love that you're asking about that, Amanda. Absolutely love it. And I think that there are some unique opportunities, some unique learning experiences. When I talk to young adults with congenital heart disease, oftentimes they will have an increased awareness of who they are and what's important to them. And so rather than think, I'll do whatever job or I'll just figure out whatever it is, I'll just go with the flow. Oftentimes they have a really thoughtful approach to thinking about what their interests are and what their capabilities are and how they will align. So sometimes they recognize what's important and are less likely to take things for granted. I think the other thing I often see, and I will say that I think young people nowadays sometimes get a bad rap for some things, but I am so impressed with the sometimes their caring nature and their desire to give back. And oftentimes young people with congenital heart disease are thinking about educational and employment opportunities where they can demonstrate their empathy. So their sense of imagining themselves in somebody else's shoes, being caring. So oftentimes they're choosing schooling or jobs that are in caring fields. So maybe teaching or being an educational assistant or nursing or medicine. Even sometimes they've pursued careers in hospitality and customer service because they're patient. So they've learned, they know that sometimes people get frustrated and responding in kindness can go a long way. So oftentimes their experiences have given them these really strong skills that actually help them in the job market and help them obtain and maintain good employment.
Mhm. There's really no substitute for lived experience when it comes to the
Absolutely.
lessons that you learn.
Absolutely, absolutely. And I think there's a reason that many people choose to go into the helping professions because they've had often really positive experiences where others have helped them and they're looking forward to sharing their experiences or to giving back.
Mhm. Thank you for that. It's so important to highlight the positive aspects, and
Oh yeah.
regardless of the struggles that someone has to go through, regardless of the health, the experiences that they've had with the healthcare system and navigating their own health struggles, there are always positives that you can derive from that in terms of what you've learned from the experience and how you've grown as an individual. So that's really empowering for people to hear that message.
Right. And I actually encourage people to think about what is it that you've learned about yourself? What is important to you? And sometimes people will say, I like writing because I wasn't necessarily able to maybe to do sports, so I learned and I developed writing skills, or people have developed skills in creativity. A lot of people I work with have really good senses of have a really good sense of humor, and so these are things actually that are helpful in a lot of jobs. Being able to um, acknowledge humor in a situation can go a long way. So I think it's acknowledging that sometimes these collective experiences have led somebody to develop skills that are quite important in the workplace.
Sure, I completely agree. And talking about the workplace now, let's transition a little bit to discussing employment. Can you discuss how CHD would ever influence the type of job or the nature of a job that someone chooses to pursue? I know you kind of touched on this before, but just to get a
Yeah, yeah. I think that understanding one's current healthcare status and their potential future healthcare status is really important so that somebody can make sure that they're not choosing a job that may be more difficult to do down the road, but they're also not unnecessarily restricting themselves from potential opportunities. So it's just finding out, are there any longer term health considerations that should be taken into account when choosing a job? I will say that one of the things that's also really important, whenever possible, and I realize not everybody has this option, however, if possible, I encourage people to not only look at the hourly wage or the salary, because things like benefits are important too. So, health insurance and disability insurance, those are things that I really encourage people, whenever possible, to seek a job that includes those benefits, because down the road, that potentially can make things a lot easier. Sometimes people can choose jobs where there's movement within them. So, although it might initially be more physically demanding, there may be the opportunity to transfer to a role that's a little bit different. So, a police officer, for example, might initially be um, walking or in a car, and then there may be opportunities for more desk-related jobs down the road if their physical capabilities shift. So, I think it's thinking about the right job again, and then it's the environment. So, how much, you know, if you're in a city, can you get to that job? Is it easy to get to, whether it's driving or public transportation or walking? So it's thinking about the big picture of what that job will be like for you. If somebody gets tired easily, maybe a job where they're having an hour and a half commute to work each day is not ideal because then they get back late at night and they're exhausted. So It's really thinking about where they are currently health-wise, where they anticipate going. And then again, it's figuring out a job that's it's not only their capacity, but it's finding out something that aligns with their interests as well.
Yeah, a lot to consider, and it's great to speak to your healthcare team, as you had mentioned, about what the future might look like so you can kind of make an informed decision
Yeah,
pursuing a career.
yeah,
And for someone with CHD that is unsure about how to navigate a conversation with their employer regarding any accommodations that they might need, can you give some guidance as to what types of information someone is required to actually disclose to an employer versus what they can choose to keep private to themselves?
yeah. And so this, I would say that I'm not an expert in this, but here's my understanding. And I would encourage people, whatever province they're in or whatever state they're in, you can Google something like, what do I need to tell my employer about my health condition? And there are actually really good resources done by each province. So you can get really clear information. It's my understanding, though, that an employer can ask about one's ability to do certain tasks, but they can't ask about ask for information about a diagnosis. This question confirm that with information that their province does put out. And there is the expectation for reasonable accommodations as well. And sometimes, there might be a job that can be done just as well sitting as it can be done standing, and that's a very reasonable accommodation. I think that probably it's not necessary to provide information though to volunteer it. You can wait, I think, until somebody is asked about those skills. So, uh, and then it becomes a different conversation. I think if somebody has an established job and then they later on develop symptoms that make it more difficult. And then at that point also, I think that there doesn't necessarily need to be a full disclosure, but there can be a conversation about which elements of the job would benefit from some accommodations and figuring out how to make that happen.
And if you're someone with CHD and you do need accommodations, try and talk to the HR department of your company or your manager about what's available to you and see if that is suitable for your needs or if there's something
Yeah,
that needs to be done.
yeah. I think that's a great point. And somewhat surprisingly, in general, I've worked with a lot of people whose workplaces have been very accommodating. So I think that also this is something that workplaces are much better now than they were 10, 20 years ago. And so there's often recognition of the importance of making accommodations and a willingness to do so. So I often talk to people who will actually say to me, everybody at work knows everything and nobody cares and it's fine. So, a lot of people that I've worked with have had, and it's not everybody, but a lot of people have had positive experiences talking about their health in the workplace.
Yeah, that's great
Yeah,
to hear the positive side of things and the
yeah,
good stories that
yeah.
yeah.
They often describe supportive bosses and supportive people in HR. So, I wouldn't want somebody's congenital heart disease to lead them to shy away from a potentially good job because that's a concern.
Mhm. Yeah, definitely take the steps that you need to ensure that you're accommodated for, but don't assume that you won't be, I
Yeah,
guess.
exactly, exactly.
Would you be able to describe to the audience how someone's socioeconomic status can impact their ability to balance their job and their CHD care?
I think that's an excellent question, and I think it's something that we don't talk about enough. I think, healthcare professionals just expect people to show up for their clinic visits and to make it a priority and arrive on time. And it can be really challenging. There's a difference between somebody who, let's say, has a salaried position and who has sick days and they can use those for doctor's appointments, or they may even have job flexibility or be working from home and they can just, go to a doctor's appointment and Nobody notices that they have the flexibility. That's very different than somebody who was working at a minimum wage job, and working in an hourly rate and only get paid for the hours when they're working. So it can be really challenging when we expect somebody to take off a day of work to go to a medical appointment, and particularly, oftentimes they might be getting an echo and a ECG and then waiting to see the doctor, particularly if you have quite a drive or a bus ride or a train ride to get there. It can sometimes take up an entire day. So we ask a lot of people, and I think it's not just going to medical appointments. It can be the cost of medications can be challenging. We ask people to exercise regularly. Well, that's okay if people can afford a gym or if they have safe places to exercise around where they live. But if somebody is in a very rural area, there may not be safe places to walk, for example, if they're on like a busy street. So I think when we, as healthcare professionals, when we make recommendations, um, it's important that we recognize these socioeconomic considerations. There was one study from the US that showed that people who had private health insurance were actually more likely to be employed, for example. People who were married were more likely to be employed. So it can make it difficult to balance those because sometimes we're asking people to choose. It's earning your wages for the day or going to see the doctors, going to a doctor's appointment. So it can be really challenging. It can also make it challenging sometimes for people to think about changing careers because if somebody is going to leave one job and wants to pursue a better job for them, taking time to go on interviews, or if there's a gap between employment, if somebody who has a partner who has a decent salary or they're living at home, it may be possible to go a few weeks without having employment. It may be really difficult if somebody is the sole or the main breadwinner in their home. So I think we under acknowledge that. I think that's why we want to help people at a younger age to figure out what careers will allow them to earn a decent salary if possible, and hopefully to have some of these benefits. But it's so easy to downplay how significant those socioeconomic considerations are. And I think we're starting to pay more attention to them, but historically we have under recognized these considerations.
Mhm.
Yeah.
And like you said, I think there's a lot more discussions surrounding the social determinants of health, but
Hmm.
they are always variable. And depending on where you live, even in more remote regions of Canada, there's often only CHD services in big cities and in tertiary care centers. So
Yeah.
into those appointments, like you said, can take up an entire day. Um,
Absolutely. Absolutely. And there's some people who it takes up 3 days because there's a travel day and a day of appointments and a day going back. If somebody is listed, let's say, for a heart transplant, for example, there may be expectations that they move to be nearer the transplant center or that they are expected to be in hospital for a period of time. Even things like undergoing surgery and being unable to work for maybe 6 weeks while somebody recovers, that's kind of a luxury for people to be able to do that, and to not have to worry about finances during that time. That's not something that everybody experiences. So sometimes that hesitation to undergo surgery or another cardiac intervention, knowing that the recovery will interfere with somebody's ability to not only do their job, but it might be keep their job because maybe if they're off work for 6 weeks, maybe there's no job to go back to. So I think that any opportunities we have to help with that career counseling, I think are really important.
And that kind of speaks to the point that you often highlight of improving the quality of life of those with congenital heart disease and not just thinking about survival, because sometimes survival might mean having to work to put food on the table for some people.
Yes.
That for them is survival rather than thinking about their heart condition.
I think that's an excellent point. Survival means different things to different people, and I think it's really important to respect where people are coming from and to ask questions about that too. I think that's part of what it means to get to know your patients. And I would say, as individuals with congenital heart disease, let your team know about these considerations that you may have. So I think that as much as possible, being open about some of the challenges that you're facing can go a long way because there may be opportunities. Maybe it's possible, to get all appointments on one day instead of spread across separate days. Maybe there's the opportunity to be flexible with scheduling, to have it at an appointment at a time that allows you to do your job. So it might be, requesting the first visit of the day or the last visit of the day, for example. So I think letting your team know about some of these challenges can sometimes really make a difference.
Sure. Your team can be your biggest advocate if they know what they're advocating for, right? If you
Absolutely.
have specific needs, definitely.
Absolutely. Yeah. Yeah.
With respect to individuals that might need to apply for any disability supports, can you give some advice to individuals with CHD for how to navigate that?
Yeah. The one thing I will say just to begin with is we know that employment is associated with better psychological well-being. Now, it's likely bidirectional, meaning it goes both ways. So if somebody has better psychological well-being, it's easier to keep a job, first of all. It's easier to get a job and to keep a job. And it goes the other way too, that having a job tends to be good for our psychological well-being and quality of life. So as much as possible, I do encourage people to keep working for as long as is medically feasible for them. So we don't want people working when it's unsafe or when it's detrimental to their health to do so. But in general, work, I think is good for our quality of life. When people are thinking of applying for disability, I think a first step is figuring out who will oversee that paperwork because it can be quite burdensome. And so sometimes it's a family doctor who oversees that. Sometimes it might be the cardiologist. Sometimes it's the family doctor getting documentation. I think it's preparing for it to be a long process. And there are differences whether one is applying for disability through their workplace, and those disability payments tend to be a little more than is offered through a provincial program or the federal program, for example. So I think it's before somebody, if somebody is working and before they decide to go on disability, I think first of all, it's learning what pathway will you be applying to, who can help you in this journey. Sometimes some cardiology programs or family practices will have social workers and they can be helpful doing this. So it's figuring out who can help with the paperwork, but also it's understanding what to expect. Because if you look at a provincial program, you can decide whether knowing the amount that you might get each month, just that can maybe help you decision about whether to apply for disability. And then if it's applying, knowing the specific rules that apply to you. So some programs will say that you can work part-time, and you can make up to X number of amount each month, and it doesn't diminish your disability. There will be some limits on what one can do. Disability for some people also offers continued or improved health insurance as well. So although the monetary amount may be, so-so, maybe if it provides access to health insurance, that may be another benefit. It is tricky, and I will say, in Canada, we don't do this really well. So um, when one applies to the workplace, it can sometimes become a headache because if somebody gets a temporary disability, there's paperwork and appointments and pressure to return to work. So it's because it can sometimes be an unpleasant experience. It's really important upfront to figure out who your advocates will be in this process.
For sure. And even though it's a complex process, I think starting the conversation and just thinking about what the options are is really helpful. So thank you
Uh,
for
Absolutely. I think it's informed consent, and which means that even when we make a decision ourselves, we want to get all the information that helps us figure out how to make the decision that's best for us.
would you be able to touch on the common fears and challenges that people have when navigating their employment, whether disability supports are part of that, or if there's other common things that you've encountered in your practice?
So I think that in my own experience, people's questions or fears regarding employment fall into two main categories. One is the extent to which their physical symptoms will interfere with their ability to do their job or succeed in their job. And the other has to do with potential reactions of others around them. So sometimes people, when they are having symptoms like palpitations or some swelling or some fatigue, these kind of things, I would say mostly fatigue and heart rhythm issues, it's wondering, is that going to interfere with their ability to do their job? So um, there can be concerns about their health status and their work performance. And then the other thing I think sometimes people will say is, what will people think about me when they find out? And even though, as we talked about earlier, people are under no obligation to divulge their medical history. If somebody goes away, suddenly leaves work, and if they are off to have surgery and then they go back after having surgery, people might understandably ask questions. And so there can be a concern about, will people think about me differently if they know about my heart condition? And oftentimes for both of these two concerns, the fears of having challenges are often worse than the experiences themselves. So people have often said, I'm really worried what people will think if I go back after having surgery, and then they go back after having surgery. And more, not always, but more often than not, they'll say something like, people were really lovely when I went back. Everybody was supportive and helpful. So again, not always, but I do often hear really nice stories about supportive and caring and considerate colleagues, just like they would be if one of their colleagues came back. So sometimes it's thinking, well, if one of your colleagues went away and had surgery or it needed some time off because they were feeling unwell, how would you feel about it? And they'd say, well, I'd be concerned and I'd hope that they feel better when they come back. And so we can kind of think through some of these things. And then with regards to symptoms, I think it's preparing, maybe discussing accommodations and figuring out who in the workplace again would help them advocate for accommodations, or perhaps and that may include job tasks or maybe a modified work schedule or a work from home schedule. And that's actually helped a lot of people navigate some of these health challenges because, if they have, let's say, a 9 to 5 job, it's different if they have to get up at 7 in the morning to have a shower and commute to work and then, walk from parking into the office, for example, versus if they're working from home and they can get up at 8:45 in the morning and be ready to work at 9. So sometimes there are ways to work through this. And as I say this, things often turn out better than anticipated. However, I don't want to minimize that some people do face genuine challenges navigating work, the workplace, though. Yeah.
For sure. And opening up to people that you trust, whether that's family member, a friend, a colleague at
Yeah.
work, kind of talk through some of these struggles and understand, is this something that I'm thinking about a lot, but isn't going to actually translate into meaningful impacts on my day-to-day life? Or is this
Yeah.
something that I actually have to address?
Absolutely. Absolutely. Yeah. Yeah.
And for someone that is potentially having some struggles or would like to learn a little bit more about how to navigate either their education or their career, do you have any resources that you can point them towards?
I think that there are some existing resources that are really underused. So I would say, and by the way, this first one is for anybody in high school. I would say take advantage of any academic and career counseling opportunities that your school has to offer. So if there's help with resumes or help with applying for summer jobs or navigating, having conversations with guidance counselors where they exist about thinking of appropriate academic pathways. So in high school, take advantage of those existing resources. If somebody's going to go to college or university, taking advantage of career counseling services on site. Every college university has people whose job it is to help navigate that. There may be some help with disability services. So if somebody does have neurodevelopmental or cognitive challenges that makes it difficult for them and they need accommodations, right away go to, or even before starting school, as soon as possible, go and meet with disability services and accommodations to figure out what help you can get. Uh, there are programs helping people, and there are workshops in terms of how to develop, how to create a good resume, for example, how to practice job interviews, do all of that, take advantage of all of those free services while they are offered to you. There are programs that help people with disabilities find and maintain jobs. So look at what is around you and take advantage of those. And I think that most people don't don't fully take advantage of those existing services that can be so helpful. So it's not only looking at how your medical team maybe can help you navigate and advocate for you, but there's these existing academic and career counseling supports in colleges and universities and in communities that can be so, so helpful.
Great. Thank you so much for outlining that. For anyone with CHD that's listening, please know that you're not alone with navigating these challenges, and there's many resources out there and many people that are willing to have an open and supportive conversation about this topic.
Absolutely, absolutely.
Thank you so much, Dr. Kovacs, for joining us today. From everyone at CCHA, thanks so much for sharing your experience and your wisdom on this topic.
Oh, it's been my pleasure. Thank you very much for hosting these events.